My name is Marissa and I'm going to demonstrate the anatomy of the heart. Here you have your epicardium, which is the outer membrane that covers the heart. Then you have your apex and the base of the heart. Then you have your right and left atria. The right atrium is deoxygenated blood and the left atrium is oxygenated blood. And then you have your right and left auricles. This is your right one and then your left one. And then you have your right and left ventricles. And your interventricular sulcus is right here. And then you have your pulmonary trunk, which you can see would be right here. Also the pulmonary artery was cut, the trunk. The pulmonary trunk is going to the left and right pulmonary arteries and it is deoxygenated. And then you have your aorta, which is located right here. The aorta carries blood to the rest of the body and it is oxygenated. Most of the aorta has been cut off, but if it were to continue, you would see the aortic arch, which carries the brachiocephalic artery, the left common carotid, and the left subclavicle. And then you have your superior and inferior vena cava and the coronary sinus. These three veins go to the right atrium and carry deoxygenated blood. Next, we're going to move to the internal anatomy of the heart. First, you have your pennate muscle, which is in the inner walls of the right atrium. This is your right atrium, so it would be on the inner walls. And then you have your myocardium of the right and left ventricles. The myocardium of the left ventricle is 3 times thicker because it requires more to pump blood to the body. And then you have your trabecular carinae, which is in the inner surface of the ventricle, which are these right here. And then you have your interventricular septum, which separates the ventricles, the left and right ventricle. Then you have your bicuspid valve, and your tricuspid valve. And then you have your chordinae tendae, which is these little white things you see. And then the cuffs of the valves, all the flaps that go into the valves. And then your papillary muscle are these papillary muscles. And then your pulmonary semilunar valve would be located in here, in the pulmonary. And then your aortic semilunar valve is seen on this side of the heart, which is located right there if you can see it. And that is the internal anatomy of the heart.